Hi, I'm Pkwy. I'm a pediatric physical therapist. If your child receives therapy services, you might have come across a term called weight bearing. And if you have come across that term, you've probably also been given some sort of a standing frame or some specialized equipment or some exercises, and then we've given you some sort of a weight bearing program to implement. Now, it's pretty typical of us to probably give you some details, actually maybe quite a few details about how to implement that program. And I know I've had reports from some caregivers that sometimes moving forward with that program can be kind of complicated or kind of confusing. And I've thought a lot about it, and I think maybe what happens is in our attempt to give you all these details, which are really important because that's the way we can customize that program for your individual child. But anyway, in our attempt to give you all the details, maybe sometimes we don't actually present a very clear picture of an underlying concept that kind of ties it all together. So I know when I get confused, usually it's because I am lost in the details without some sort of an anchoring principle to hold on to. So these weight bearing modules are an attempt to see if maybe we can pull some ideas together and give you a little bit more of a broader concept of why we're doing all this, and then we can tackle the details from there. So, well, basically if we're going to talk about weight bearing, let's start with the definition. What is weight bearing? Weight bearing is really just a body part resisting or supporting weight. So the definition is not very long, it's pretty straightforward, but well, sometimes it might be kind of hard to wrap your head around what a real world application of what that definition means though, right? So let's see if we can take a closer look at some examples of two different ways of looking at exercise and see if we can get some information out of those two different kinds of exercises that help us understand that weight bearing program a little bit more. I'm going to show you some pictures here. The first group of pictures, you see we have our little guy here laying on his back, and he's doing some typical movements that you might have performed in an exercise class somewhere. We've got arms waving up in the air or legs waving up in the air, and he's doing lots of different kinds of movements and positions, but in most of these cases what you're going to see is that the limb that we're talking about, whether it's the arm or the leg, is kind of waving around in the air, so to speak. Now in this next group of exercises, what you're going to see is we have our guy standing up now. And he's leaning and moving and bending and doing all kinds of different things. And in this case, the difference here is that the end of whatever the limb is that we're talking about is fixed against something. And typically the thing that it's fixed against is the ground. And so we kind of have two different versions of exercises. We have this first group of exercises where the end of the limb or the arm or the leg that we're talking about is kind of out in space, and then we have this second group of exercises where the end of the limb that we're talking about is anchored against something. Okay? Now, in both cases, good things are happening. Muscles are moving, strengthening is happening, coordination is being challenged, but there's a difference between the two groups in what is happening to the bones in the two situations. And that difference has a lot to do with why your child has been given a weight bearing program. Now for some children, they may have the ability to move, but those movements might only be that first kind of movement that we talked about, where the end of the limb is sort of out in space, as compared to that second group where that limb is anchored against something. Now, a side note, we're going to see here, we typically have been showing you pictures that have to do with the legs, but we can also fix the arms against the ground too. For example, if you do a push-up, basically that end of your arm or your hand is now anchored against the ground. So this is one of those weight-bearing scenarios, in this case for your arms. So why does it matter if a child can't engage in or has difficulty with this second kind of movement where the functional end of the limb is fixed against something? And how does a weight-bearing program help? Well, that is what we're going to investigate here. Now, we might have already given you a list of benefits, particularly if you're in a standing device. So then we might tell you that that this device promotes a good self-image. It seems to help with the cognitive function, and it's really great for the social interaction aspect of being up and eye level with your peers. But there's also some medical benefits too. There's respiratory and circulatory benefits. There's bowel and bladder function that improves when you're up in that weight-bearing position. It increases range of motion, and it prevents joint contractures. Contracture basically is just a word that means the joint is not able to go into its full range of motion like it's designed to go into, because for some reason the soft tissue around it is preventing it from going into that, that normal full range. And then the last one is that it improves bone strength. Now, that last one is the one I probably get the most questions about. So let's see if we can kind of figure out how a weight-bearing program might help with bone strength. Let's think about a skeleton. Now, one way in science, if we want to figure out what something does, we basically either add something or take something away and we see what happens, right? In essence, we're running an experiment. So let's kind of take that idea. Obviously, we can't or wouldn't want to take away a skeleton, but let's just make this a theoretical experiment, and let's imagine what would happen if we were somehow able to get rid of the skeleton. First thing I can think of is that it would no longer look like a body. It would lose structure and shape. So one thing the skeleton obviously does is to provide some structure and some organization. Okay, that's one thing. Second thing I would notice is things like the heart and the lungs and things like that that are vulnerable organs would no longer have a nice, safe, protective covering. So the skeleton provides a role of protection. Third thing we might notice is that the body would have great difficulty moving, because without the bones, the muscles wouldn't have a place to attach to for a mechanical advantage of movement, and so the body would have a great deal of difficulty moving somewhere. So obviously the skeleton helps with movement. Now, those would be the observable problems, but there's also some things that a skeleton offers that are not quite so easy to see. You might think of the bone as just a bone, it just sits there, right? But actually the bone is considered an organ. And because it's considered an organ, it has responsibilities and things that it does that actually function outside of its role of just holding you up. So it's an organ just like a liver or a spleen, and it has its own jobs just like they do. One thing it does is, inside the bone is something called bone marrow, and bone marrow is actually the site of blood cell production. So that's a pretty important role. Another thing it does is it kind of serves as a storage facility, basically. It stores lots of things. One thing you're probably really familiar with because of the media is calcium. The bones store calcium, and that calcium makes them nice and strong. But one thing you might not know is that calcium is also really important for the function of other things like nerves and muscles who can't function without calcium. And it happens that if you have something that can be stored, it also can potentially be released. So the skeleton has the ability to not only use the calcium for its own needs, but to release that calcium into the body, into the bloodstream, and let it be used in other places too. So basically, the skeleton's a pretty important thing, right? And so how do we keep that skeleton healthy? Well, things like, obviously, genetics. Some people just come with stronger bones or a tendency for weaker bones. We have disease processes that affect bone strength. We have some medications, some which may be detrimental to bone structure and bone strength. Others which now we're finding some medications that actually help with bone strength, so that's good. Diet, things like calcium, vitamin D, things like that. And so all of these things are super important, but given my sort of therapy bias, the important role of the skeleton with regard to structure and protection and movement is something that's really important to me. And so given that therapy bias, I'd like to look specifically at some of the mechanical influences behind your weight-bearing program. So in the next module, we're going to tackle the structure of bone itself.